Vitamins that eliminate neuropathy and regenerate damaged nerves. Do you suffer from that constant pain in your feet and hands that feels like fire burning inside? Have tingling and numbness robbed you of sleep and limited your daily activities? What if there was a natural solution that could not only alleviate but solve the problem at its root? Neuropathy affects millions of people silently, but today I'm going to share a truth that many doctors don't reveal. In many cases, it is possible to not only control the symptoms, but effectively reverse the problem with natural methods. Today, you will discover the essential vitamins and powerful nutrients that can eliminate your symptoms and regenerate damaged nerves, regardless of your age. The pain and tingling are just the beginning. I'm going to reveal other symptoms you need to recognize. And most importantly, I'll show you the warning signs that indicate when neuropathy is reaching dangerous levels. Let's get started. What really happens to your nerves in neuropathy? Neuropathy is damage to the nerves that connect your brain and spinal cord to the rest of your body. Think of your nerves as sophisticated electrical cables that transmit vital signals to every part of your body. These nerves have a protective covering called the myelin sheath that keeps them functioning properly and healthy. This special covering allows electrical impulses to travel quickly and efficiently through all nerve fibers. When the myelin sheath is damaged, it's like having bare electrical wires inside your body, causing painful short circuits. This protection can be compromised for several reasons: nutritional deficiencies, toxins, inflammation, or chronic metabolic problems. The result is impaired neural communication that manifests as pain, tingling, numbness, and other symptoms. Understanding this process is key to solving the problem at the root, not just masking the symptoms. Two types of nerve injuries that cause silent distress. 1. Sensory nerve injury, the origin of mysterious pain. The first type affects the nerves that control our sensations, resulting in burning pain, tingling, and numbness. This form is known as sensory neuropathy and completely distorts how we perceive normal physical sensations on a daily basis. Symptoms begin subtly, a slight tingling that you may ignore for weeks or even months. Over time, they progress to more intense sensations, such as constant burning that often worsens during the night. Neuropathic pain has unique characteristics that distinguish it from other types. It seems to come from the inside out. This pain rarely responds to common painkillers, making it frustrating for those who suffer without a correct diagnosis for years. You may feel as if you are walking on broken glass or hot coals, even without external stimuli. But there is a second type of injury that, although less painful initially, can be even more limiting. 2. Motor nerve injury, when your muscles start to fail. The second form affects the nerves that control your movements, causing progressive muscle weakness and motor incoordination. When motor nerves are compromised, simple tasks like buttoning shirts become surprisingly difficult to perform. This unexplained weakness does not improve with rest and tends to gradually worsen without appropriate and effective intervention. In advanced cases, it can progress to muscle atrophy, the visible shrinkage of muscles from forced disuse. Many patients discover late that the weakness they felt was actually a sign of motor neuropathy. The problem usually starts in the extremities and progressively advances towards the center of the body with time. This pattern of progression is an important diagnostic clue that helps differentiate it from other neurological conditions. Now, let's explore the root causes of neuropathy that many healthcare professionals often miss. 5 main causes of neuropathy that your doctor may not mention. 1. Vitamin deficiency, the invisible thief of neural health. Lack of essential vitamins is a primary cause of neuropathy that is often overlooked during conventional diagnosis. B vitamins are particularly crucial for nerve health, especially B1, B6, B9, and B12. These vitamins function as enzymatic cofactors necessary for energy metabolism and maintenance of nerve cells. Vitamin B12 deficiency is surprisingly common, affecting up to 10% of undiagnosed older adults. Low levels of these vitamins can occur due to restrictive diets, medications, or chronic intestinal absorption problems. One cause often overlooked is the presence of intestinal parasites that steal nutrients without overt digestive symptoms. Appropriate supplementation can quickly reverse damage when identified before it becomes permanent and irreversible. 2. Medications, when treatment becomes the problem. Certain commonly prescribed medications can trigger or aggravate neuropathy as a side effect rarely mentioned by doctors. Metformin, used for diabetes, can dramatically reduce the absorption of vitamin B12 with continued prolonged use. Antacids such as omeprazole can also cause deficiency of these vitamins when used regularly for extended periods. Chemotherapy drugs, certain antibiotics, and statins are among other potentially neurotoxic drugs for many sensitive patients. If you take these medications regularly, monitor your B vitamin levels annually to prevent neural damage. The core idea is to identify the true underlying cause of the problem in order to effectively treat it at the root permanently. In many cases, adjusting medications or supplementing specific nutrients can completely solve the problem without invasive interventions. 3. Nerve compression, the hidden danger in your daily routine. Neuropathy can also arise when something compresses your nerves, disrupting neural communication vital for functionality. Structural problems such as herniated discs, spinal stenosis, or carpal tunnel syndrome create pressure on nerves. Poor posture, repetitive motions, or prolonged periods of improper sitting can cause silently progressive nerve compression. Tumors growing near the spine, or nerve pathways, can also compress nerves and create symptoms similar to neuropathy. Many patients suffer from hand pain due to problems in the cervical region that are never properly diagnosed. In most cases, this results from muscle contractures caused by chronic stress and poor body positioning. Specialized physical treatments, or simple ergonomic modifications, can significantly relieve symptoms in a few weeks effectively. Early identification of compression is crucial to prevent permanent damage and achieve full recovery quickly. 4. Diabetes, the silent killer of your nerves. High blood sugar levels are extremely damaging to the small vessels that nourish the peripheral nerves. Diabetic neuropathy affects approximately 50% of patients with long-standing diabetes without adequate control. Excess circulating glucose damages the small blood vessels that supply oxygen and nutrients to the nerves. This process essentially suffocates the nerves, depriving them of the supplies necessary for normal cellular function and repair. Even small improvements in glycemic control can significantly reduce the pain and progression of diabetic neuropathy. Diabetes not only damages existing nerves, but also compromises the natural mechanisms of efficient nerve repair. Specific nutritional strategies can simultaneously improve glycemic control and provide neuroprotective nutrients for complete recovery. Diabetic patients should be vigilant for early signs of neuropathy and act proactively without delay. 5. Vitamin B. 6. Toxicity, when the medicine turns into poison. Surprisingly, excessively high doses of vitamin B6, pyridoxine, can cause neuropathy instead of effectively preventing it. This condition, called pyridoxine-induced neuropathy, occurs when we supplement this vitamin in inadequate amounts for a long time. The same nutrient that in adequate doses protects nerves can damage them when consumed in excess uncontrollably. Doses above 100 milligrams daily for prolonged periods can cause neuropathic symptoms in sensitive people. Balance is key. The line between therapeutic benefit and toxicity is blurrier than we realize. The symptoms of B6 toxicity are indistinguishable from common neuropathy: tingling, numbness, pain, and weakness. This cause is often overlooked by doctors, who do not associate the symptoms with the use of seemingly harmless supplements. The good news is that these symptoms are usually reversible when excessive supplementation is stopped early. 3 danger signs that require immediate medical attention. 1. Loss of sensation, when your nerves go silent. Total loss of sensation in the extremities represents an advanced stage of neuropathy that requires urgent medical evaluation. When you can no longer feel touch, temperature, or pain in specific areas, you are at significant risk. This insensitivity can lead to serious injuries not noticed: cuts, burns, or excessive pressure without pain. Without the protection of the pain warning system, small lesions can develop into ulcers before they are noticed. It's as if your body's alarm system has been completely disabled, leaving you vulnerable to damage. Paradoxically, the absence of pain at this stage does not indicate improvement, but rather a critical state of neural impairment. Diabetic patients with this symptom are at particularly high risk for diabetic foot and possible amputations. Immediate medical intervention can prevent life-threatening complications, such as severe infections and gangrene in extreme cases. 2. Severe weakness, when basic movements become impossible. Muscle weakness that compromises basic daily activities indicates advanced nerve damage that requires specialized intervention immediately. If you can no longer hold objects or perform your personal hygiene independently, seek urgent medical help. This functional disability represents a significant disconnect between your brain and muscles and can progress to paralysis if ignored. Paralysis represents the final stage, where communication between brain and muscles has been severely compromised or disrupted. When your motor nerves fail completely, it's as if the electricity that energizes your muscles is permanently shut down. Advanced muscle atrophy can follow quickly, creating structural damage that can be irreversible even with treatment. This symptom often requires a multidisciplinary approach involving neurologists, physiotherapists, and specialists in rehabilitation medicine in a coordinated manner. With early intervention and aggressive therapeutic approach, even severe cases can see significant functional improvement and recovery. 3. Uncontrollable pain, when conventional treatments fail completely. Severe persistent pain that does not respond to conventional analgesics indicates severe neuropathy that requires specialized attention. This type of pain persists relentlessly, often worsening at night and causing chronic debilitating sleep deprivation. The intensity can be so extreme that it interferes with all normal activities, leading to social isolation and depression. Patients describe this pain as constant torture or unbearable burning that completely dominates their thoughts and existence. When conventional medications fail completely, it is a sign that the pain mechanisms have become centralized and pathologically amplified. Refractory neuropathic pain often requires complex combinations of neuromodulatory medications and integrative complementary therapies. This symptom may indicate progression of the underlying condition or development of central sensitization in the permanent nervous system. Fortunately, even in the most challenging cases, integrative approaches can offer significant relief when properly implemented. The two-pillar strategy to beat neuropathy for good. 1. Powerful nutrients that repair your nerves. The first fundamental pillar involves providing specific nutrients that your nerves need to repair and regenerate effectively. Your body has an impressive capacity for self-recovery when it receives the right compounds in the right amounts on a regular basis. This nutritional approach works with your body's natural mechanisms, enhancing intrinsic neural healing processes. It's like providing perfect building materials for your body to rebuild damaged nerve structures efficiently. Even after years of progressive damage, peripheral nerves retain regenerative capacity when properly nourished and protected. Synergistic combinations of specific nutrients work on different aspects of neural recovery for long-lasting superior results. Let's explore the 3 most powerful natural compounds for nerve regeneration, proven both scientifically and clinically. These nutrients form the basis of an effective nutritional strategy against peripheral neuropathy of various causes. 3 powerful natural compounds to repair damaged nerves. 1. Alpha-lipoic acid, the ultimate neural protector. Alpha-lipoic acid is a potent antioxidant that protects nerve cells from oxidative damage and promotes regeneration. Found naturally in organic meats and dark green vegetables, it is also available as a highly bioavailable supplement. This unique compound easily crosses the blood-brain barrier, protecting both the central and peripheral nervous systems. Alpha-lipoic acid fights free radicals that damage nerve cells and helps restore glutathione levels. Clinical studies show that doses of 300 to 600 milligrams daily significantly reduce neuropathic pain. In addition to improving neuropathy, it also helps with glycemic control in diabetics and offers cardiovascular protection. Patients typically begin to notice improvement after 2 to 3 weeks of use, with benefits progressively increasing. Consult your doctor before starting this supplement, especially if you use diabetes or thyroid medications. 2. Curcumin, the natural anti-inflammatory for your nerves. Curcumin, the active ingredient in turmeric, has extraordinary anti-inflammatory and neuroprotective properties that have been scientifically proven. This powerful substance significantly reduces systemic and neural inflammation, relieving pain and discomfort associated with neuropathy. With more than 12,000 published scientific studies, curcumin demonstrates the ability to modulate different inflammatory pathways. To maximize its absorption, always combine curcumin with black pepper or healthy fats like olive oil. The piperine present in black pepper increases the bioavailability of curcumin by up to 2,000%. Quality supplements often contain piperine or enhanced absorption technologies to ensure superior therapeutic results. Typical doses of 500 to 1,000 milligrams twice daily are considered safe and effective. 3. Magnesium, the essential mineral. Your nervous system craves. Magnesium participates in more than 300 enzymatic reactions in the body, including many directly related to nerve function. Deficiency of this mineral is extremely common in the modern diet and often manifests as neuropathic symptoms. Different forms of magnesium offer specific benefits. Threonate crosses the blood-brain barrier, while glycinate has superior absorption. Magnesium regulates NMDA receptors in the nervous system, the hyperactivity of which is directly linked to chronic neuropathic pain. Proper supplementation can provide quick relief from symptoms such as tingling, cramping, and burning sensations in the feet. Combinations of different forms of magnesium may offer broader benefits for the entire nervous system. Typical doses range between 200 and 400 milligrams daily, divided throughout the day for better absorption. 2. Eliminate neural toxins, removing obstacles to recovery. The second fundamental pillar involves removing substances and habits that continually damage your nervous system and block recovery. It's pointless to try to repair damage while continuing to expose your nerves to the same toxins that caused the problem in the first place. It would be like trying to fill a leaky bucket. No matter how much you add, progress will be sabotaged. Many people focus only on adding supplements without eliminating the real neural health saboteurs on a daily basis. Simply eliminating these neural toxins can, in itself, provide significant relief even before any supplementation. This dual approach, nurturing and protecting, creates the ideal environment for your nerves to fully recover. The combination of these two pillars forms the basis of a complete strategy that has helped thousands of people. Start your journey to neuropathy-free living today with these simple and effective steps. Your new life without neuropathy starts today. Neuropathy may have robbed you of your quality of life by now, but you have the power to change. Your body possesses incredible self-healing capacity when you provide the right nutrients and eliminate harmful toxins. The pain, tingling, and limitations you feel right now don't have to define your future or restrict your possibilities. Thousands of people have already overcome neuropathy by following these same strategies that I shared with you today. Damaged nerves can gradually recover with proper care, returning normal sensations and normal function. The transformation starts now. Take care of yourself, invest in your neural health, and take back control of your life. You deserve to live pain-free, energetic, and well-being, fully enjoying every moment without neuropathic limitations. Decide today what your first action will be for recovery, and take the first step with confidence. Your neuropathy-free future starts now, with knowledge, determination, and a clear plan for neural restoration.